I've been building AI systems for 32 years. I built the first electronic medical record in the US that had integrated AI. My oldest son and a friend of his got involved in drugs. The friend passed away. And so my wife and I decided with some time and some resources, and we said, you know what, let's try and help. Fast forward, we built one of the largest opioid treatment programs in the country. We had 300 patients in residence every day. So that's how the company was born. That'll give you a short history, how we came to today's discussion. What we discovered that they hadn't heard before, we've discovered inside of every patient file are indicators until AI couldn't be found. We talk about prevention and why is it preventative? The NIH reports 75% of patients entering opioid treatment started with a prescription written by their doctor. When you walk in the front door of an opioid detox center, you're crazy sick. There's all these illnesses that go through, and 100% of the patients who come to opioid treatment suffer one or all of these illnesses. And then I tie the parallel to, now what if this was your next door neighbor or the next to your office or your cubicle? The unique piece is that inside of an opioid detox center, you were under our care. Now your neighbor had knee surgery, but the thing that's different is now the body's trying to heal. And what happens is when the body heals, the pain becomes very fluctuating. And because of that, you become very inconsistent in taking your opioid prescription, which exactly duplicates what an opioid detox center is like, because it throws you into withdrawal. And those illnesses that come with withdrawal then are the exact same illnesses that come with the body as it heals. We can prove, but 30% of every American who's prescribed an opioid suffers a withdrawal symptom severe enough that they go see a doctor just for the withdrawal symptom. So they're nauseated and they go to the doctor, and the doctor starts treating them for nausea, never thinking that it's linked back to the opioid, because they're prescribed the right dosage. There's no drug-to-drug interactions, all the typical things the doctor would do, never dreaming or having experience with the fact that maybe you're not taking your opioid every 4 hours, because opioid half-lives are about 4 to 5 hours. And you should be taking a dose while you're awake every 4 to 5 hours. You're skipping lunch because you're working through lunch, and you're suddenly putting yourself into withdrawal, never thinking about it. So there's nothing intentional going on here, but it's duplicating what happens in a detox center. But the difference is now your health plan's paying for those extra medical encounters because of just the whole process of the body healing and the uniqueness of opioids, because opioids aren't like other chronic conditions. And then the defining differences are the entire industry is geared towards tracking behaviors. You're acting out, you're trying to doctor shop, going to multiple pharmacies, doing those sort of things. And that's what the entire industry tracks. And they do an amazing job doing that. But the problem is you're already addicted at that point. You're already chasing the opioid. There's no opportunity for prevention. As opposed to, because of our experience inside of the detox center, we actually are tracking withdrawal symptoms, which are those medical conditions that people show as not being consistent when they take their opioid. What the algorithm does is it verifies that none of these medical conditions started until after you started the opioid. Obviously, one of the key things inside that data file, what date did you get prescribed the opioid? And then we can start to track these medical conditions of when you started prescribing. And then we found lots of research that shows that these withdrawal symptoms show up 5 months before the first addiction symptom, which gives us a 5-month head start on any technology in the market. And during that 5 months, the average patient in America incurs $15,000 in unrelated healthcare costs due to withdrawal in 30% of the time. 30% of those patients incur up to $15,000. So that's our business opportunity. We're intervening and saving 75% of that number on every patient we can identify, to the 30% number just to run it home. And then the thing that the industry does is it tracks the obvious things, like an iceberg, what's above the waterline. They track how you're acting out because they see it. And what we find are those things that are the buildup to it that you don't see on the surface. But then by finding those, we can keep it from ever getting to the surface. What the product does, where it spiders through, and we never identify a patient, and we're really looking to scrape the doctor, and we use retail pharmacists to do it. And then these are our results. We've got 1,700 small employers using our software every day. We've run about 1 million lives through it. And the results, we reduced unnecessary opioid prescribing 75% across our entire install base. And the average savings per employer is about 5% of their total medical spend, which is a gigantic number. Their increase in premium this year may be 5%. So we literally could completely offset that. 95% of all the doctors we've approached to make changes have adopted them. And we've never contacted a patient. And because we file a claim with the health plan, because we're a pain case management company, no upfront cost for the employer and no cost for the employer because it's paid for as an insurance claim. This is our school district case study, and these are the actuals. We reduce over medication of opioids, those healthcare encounters, those withdrawal symptoms that I talked about. You were going to the doctor. We actually reduced their healthcare encounters over 50% in that period. You had 37% less ER visits than you had before we started. You had 40% less doctor visits, almost 40% fewer hospital visits. And it's all because of the fact that 312 out of the 315 doctors that we identified adopted the changes. And that's why we got the results. Health, wellness, staff, mental health. Obviously, Joe's line, we save lives and save money. And then we've talked about a lot of stuff, but the only way for us to really show you is give us your last 12 months of paid pharmaceutical claims, and we'll come back to you with what we call the prescription compliance report. No cost, no risk, no commitment, but you'll now know how much opioids are impacting you and your employees. What we're saying is now to get you these results for your client, just get us the last 12 months of paid pharmaceutical claims.